ますね。目閉じてくださいね。ちょっと痛いですよ。ちょっと痛いですよ。チク。
じゃあちょっと待ってくれ。
ああ、大丈夫です。
空気抜いてくださいね。
こっちにします。
うん。今はほとんど痛くないでしょ今。こっちちょっと痛いよ。OK。じゃあちょっと目裏返しますね。じゃあこっちちょっと引っ張ってください。サージャルジャンクション。3 point. Lateral one. Median one. And medial. OK。反対側も行きますね。And for the medial epicanthoplasty, I'll do very small amount. I used maybe 0.6 to 0.8 for both sides. And 目開けていただいて、This is the line where I want to go. これちょっと痛いよ。I'm now doing hydro dissection. I really think this is very important in detaching the skin and orbicularis of the muscle. This is hydro dissection. Which one? じゃあほとんど当てますよ、痛いの。じゃあ目開けて。じゃあ目開けて。眩しい？ 오케이. 자, 이따이요. You can give me yes question.
Can I ask you a question, Dr.
Yes, of course.
Yeah. Before you make a line simulation, right?
Mm.
And the line is rapidly gone.
Mm.
Yes, after
Mm.
after you make a line,
Mm.
does it mean we prefer do a transcutaneous blepharoplasty?
Eh?
Does it mean we prefer do a transcutaneous blepharoplasty?
blepharoplasty?
Transcutaneous open.
Open.
If the line
The same
is,
line?
If the line is rapidly gone
Hmm.
after you make a simulation.
After I make a simulation?
And then the line is rapidly gone, right?
Yes.
Yes. Does it mean we prefer the transcutaneous blepharoplasty rather than this method?
Yes, yes. When it disappears, I suggest 2 times. Just one time, maybe doctor's talent is not good enough. So at that time, I suggest 2 times. But after 2 times, it fails. I suggest you to go to the surgery.
ダメな
Cut.
話になりますよ。
Jadi tetap dicoba dulu ya.
すいません。メッセージを送ってください。じゃあ、let's start.
Thank you.
OK。始めますね。自然入着と目頭切開両方で SNS 用は出てない条件でモニターで本日やります。特に問題ないんですよね。カメラもっと上にカメラ Please set up the camera. That's the smooth.
向こうの P がありますか？田口さん。
田口さん。
はい。
向こうの P もらってもいいですか？向こう、ライン。
はい。
With a sharper suture. number 4, this muscle, orbicularis ocular muscle, or the node. Maybe this is muscle and some subcutaneous. This is orbicularis ocular muscle, a little bit. こんなたくさんの患者さんの前でちょっと患者さんじゃなくて先生らの前でちょっと緊張してます？大丈夫です。本当に大丈夫です。逆に私気使ってすごい頑張ってやりますので。So I use this one 70. Dr. Ro.
Right here.
Okay. This one is a double arm one, double arm, and 35 centimeter long and 19 millimeter, and the round one.
Is that proline?
Yes, it is not a flooring. It is a nylon. And 半分切ってくださいね。
Can we use it poly? Can we use it polypropylene?
Yes,
or
of
poly?
course. Flooring much better,
Much better.
Okay. But expensive. Flooring strength very nice. 正常く？
はい、そこです。これ逆にそうでしたっけ？いつも通りなんですね。
これがなくなっちゃったよ。
injection.
はい。
Little kind month of the little kind injection.
Months of the amount of the lidocaine injection, maybe total 1 to 1.2 millimeter.
One?
1 to 1.2 millimeter.
Okay.
Because this is water, GB is water dissolver, and she makes some, how can I say, tears, so it goes away easily. So very important thing is C or A, BCD line is very BCD point is in your mind, but A point is your before decision. So keeping A point is important. So let's do it. I cut the half. Number 4. And flip it over. And when you flip it over, my needle is almost here.
The junction.
Yes, junction. Take her tarsal plate is a little bit wrong.
ที่พี่ดำเขาบอกเขาทานซันสกรีนไม่เป็นไรแต่เคยเข้าว่าเป็น deformity ไม่แน่ใจเนี่ยเขาเข้าเนี่ย
痛み大丈夫ですか？
痛みないんですよね今。She says no pain. Yes.
We don't need a corneal protection or something.
You can use.
And do you have any experience about the laceration because of the threads or the corneal laceration because of the threads? No.
When I do the raw blepharo, it sometimes happens, but almost none lately. 3, 2, 2.
You didn't go through the tassels, right?
Yes. さ、
はい
テープがいいわ。
それでいいですか？
うん、いいです。ちょっとこれ半分切ったので間違いない？
はい。短い。
うん。それ長いでしょ。
うん、ちょっと。
うん。新しいやつ出してね。すいません。ちょっとこの thread is not too long enough, so I'll prepare another one. さん、私がやる。真ん中。I will remove this suture. If you look closely, you can find it is something like you remove the stitch when done. 接しも一個。You find the thread. And you cut it. Get it fragmentation.
Yeah.
And then you can easily put it over. Easily put it over. 長さ十分。
はい。
OK。じゃあやりますね。もう一度しますね。If you want no bleeding, just do it slowly, very gently, and no bleeding.
So this point is between 2 and 3, right?
Hmm?
In this point and the tassels.
One more. One. Pardon. One more time.
The point you suture is a middle between 2 and 3, right?
Yes, right.
Why do you do that?
Hmm?
He's asking why do you do that?
Oh. To make it equal. Okay, number 1. And the number 1 is a little bit challenging. and then number 3 or number 2 or number 3. This time I'll go to number.
How you choose number 2 or 3? How you choose? You do number 2 or 3?
This is number 1, 2, 3, 4, 5.
Is it number 1, 2, 2 or 3? How you choose?
It depends on your mind.
No.
No criteria, no rule.
If I wanted to evert the lid without using my fingers, would I use that round, that Chalasia?
Yes,
type
that
plant?
would be nice.
Okay.
Which way like more easily?
I use a finger.
Whatever works.
Okay.
Depends on how big your finger, right?
さあ目開けていただいて上見てこうやったらなんかスウェーリングなしのいい感じで OK
Very nice.
はい目閉じて
目フォーが
反対側いきますね
治療。ว่าหัวตา10 รอบ
อันนี้คือมัน
そうだね
มันด้วยนะ
そんなに良くないよでもいつもこれですごい時間かかって GB ちょっと購入しといてそうですね目開けてかわいいね
มัน
じゃあ反対側いきますねナンバー4
ถ้าเกิดไปที่ลิฟต์มันใช้มันตรงแต่จริงๆมันเฉียงนิดนึง
テープ貼っていやそっちじゃなくてテープのエンドを貼ってで糸が抜けたら終わりだから痛いちょびっと鍵盤通すときにはちょっと痛いよ申し訳ないんですけどちょっとだけ我慢してくださいねちょっと引っ張ってじゃあ引っ張ってくださいか
เรื่องไม่ได้เข้า
ขอให้เขาเฟรมให้ดูนะ
I saw the bleeding inside here. Maybe I touched the blood. So at that time, just make pressure 1-2 minutes. No problem. 次の患者さん何時から来る予定ですか？1時半。1時そしたら1時まではちょっと終わらせてやった方がいいですね。ちょっとスピードアップします。
You usually see the exposed suture from the wound. I mean, the exposed suture from the tiny wound.
Export suture?
Yes, I mean the complication like after surgery, like for a week, the exposed suture. I mean, you see the thread
Yes.
out from the small wound.
Yes.
Have ever you?
Oh no, I will do it buried
After
after
I mean, every single.
Yes. So no problem.
But what if we have the expose at a week, at a 7 days? If we see
Exposure?
Yes.
If we have a case of exposure case.
Yes, because we can't cut it, right? Because the crease will be gone, right?
I haven't experienced the exposed case.
Okay.
Sorry.
Like simple suture
But
for the skin.
if the thread come out exposed, you have to remove it and you have to do it
really?
again. Because infection rate and I think maybe tension is not enough. Then it would not last long enough.
Okay.
じゃあ目開けて、目閉じて。目開けて上見て see the regularity and see the difference and see the similarity and then important thing is tension I think 目閉じてそういう感じですよmaking a loop just enough to make this hide the knot. Then make a
ไม่ได้ดึงอะไรเลย
loop. Make a 3 loop. And cut it very 0. ちょっともう深くないです1ミリじゃなくて 0.5 ミリリットル like this and then hide this on the place where I cut the orbicular ocular muscle. Okay. 自信The tension is very important. The the place where you can hide, but not too much. If you make too much strength, then it is hard to open eye. And hide the that knot buried inside it. じゃあ目開けていただいて、上見て、目開けるの問題ないんですよね。OK。じゃあ鏡ちょっと見せてくださいね。ビューティフルだって。ビューティフルですって。鏡ない？そっちにあるじゃん。そっちに書かれてある。目悪い？めちゃくちゃ悪い？いい感じですよ。気にしなくて大丈夫。これ幅広いのは後で後日でちょっと十分。Okay, let's do it one more time on anesthesia because it took maybe 30 minutes to so the anesthesia became weak. So one more time. Maybe she will not tell pain too much this time. あんまり痛くないんですよね。
痛み大丈夫ですか？はい。
こちらもあんまり痛くないんですよね。こちらはちょっと痛いでしょ今。じゃあそしたらメスください。15番で。お、大丈夫？
大丈夫。
触ってなかった。あ、11番で。
大丈夫です。
じゃあ目開けて、目閉じて。糸切りがこれいやそうか黒いやつちょっと出せます？うん。Just for the skin and the orbicularis oculomuscular dissection. こうやって引っ張って、こうやって引っ張って、こうやって。Now I cut the skin and I can see this is the orbicularis oculomuscular and you see this area is very important. You see this is orbicularis oculomuscular and this is the skin and detach between skin and orbicularis oculomuscular. if you touch the muscle, bleeding comes out. So, as you see, this is the muscle. This is the skin. And then let's go inside here. As someone asked me, I left some tissues over here too. If you see this, okay, this is the muscle that forms the, okay, 자, 하실 this is the real muscle that forms the Mongolian fold. Maybe, but then. Okay, you see, this is the orbicularis oculi muscle that forms the Mongolian fold. Okay, camera, I will talk close up please. This is the orbicularis oculi forming muscle. Okay, one more time. 매閉じて, 매開けて. This is the orbicularis oculi muscle and this muscle. This muscle is orbicularis oculi forming muscle. So I want to exercise them. 자, 아저씨引っ張って. そっちじゃなくてこっち横方向で. This is orbicularis oculi forming muscle. Okay, 外して。ちょっと引っ張って。外して。And the upper part. 引っ張って。
So you cut all of them, Dr. Baek?
Yes.
The upper part, lower part, and the middle part?
Yes, right. Exactly. Okay. And I think almost all is
Sorry, Dr. Baek, can we cauterize it or was excision?
yes, you can cauterize, but cauterizer device, energy-based device, makes some burn to the skin. So in area like this, why I using skin redrape is not to make scar tissue. So I as far as I can, I try to not to use this kind of thing, just the pressure and something like this. Okay, and then simulation. 자, 매開けて this place to this place, like this.
This
Yes. suture 目閉じてパッて外して
お願いします。
じゃあ目開けて OK I think it is a very good one、目閉じて大丈夫ですよ眩しいでしょ目開けて So we have a remnant skin here like this because 目開けて If you see the right and left you can see the difference of the opening of the eye This area small this area middle Okayもうちょっと剥離しますのでこちらちょっとこちらこうやって引っ張って、
目閉じてて大丈夫ですよ。
Don't make tension on this area. Leave as many tissue as possible. 外さないからなくていいんですよ。得意を見てるから。じゃあ目開けて閉じてアイロンください。
フローリー。
フローリー。
半分切っちゃっていいですか？
目開けてThe dog ear treatment always challenging.閉じて 자, 目開けて OK Too much skin excision would lead to the scar tissue, so abundant tissue excision left is preferable, but and if you see the bulging of the skin, if you don't cut too much, then use CO2 razor to diminish the volume. Here you see a little bit over here. Can you feel? So I see, but the length goes longer. 目開けて I think it is enough. Okay, but 目閉じて I think it is enough, but let's do some more. 또 because you know this is a subciliary incision line, and maybe you have experience that leaves almost no scar after 6 months.
Yeah.
So lengthening is not that dangerous, or not is not the bad one. No tension suture is very important. Just to make a small tie. No tension. Okay, let's go to the another eye.
If you have the dog ear in the upper, you do the same thing. Right?
Yes, yes, yes.
Skin trimming is it?
Yes, if we have abundant skin on the upper area, then I'll do the same thing. 目開けていただいて。I also, as you said, I see some abundant skin here, but you can cut it, you can trim it or not. But you said it, so I want to see, I want to show. So 目閉じて。And the important thing when you cut over here, 目開けて is not making this, cut this area, cut this backward area where you can hide the tissue, where you can hide the scalp. 目閉じて。目を開けて。
Do you leave those in for how long?
For 5 days to 7 days. 目閉じて。開けて。2件目の手術はコポール使ってやりますね。
はい。
Okay. Let's finish. 次のやります。じゃあ目開けて。私いきますね。これ外して。麻酔2回いただきます。うまくいってますよ。目開けて。出てたらいいですか。電気つながってます？
そうですね。やってないですね。
パワーオンしてない？
してます。接続のところどうなってるんですか？あ、一回接続し直しました。はい。あ、来てない。来てない。
なんで？
ちょっと一回接続ギュッてやってみますね。それでも来てなかった私。
電極斑？大丈夫？
電極斑は大丈夫です。ダメですね。
これなんかずれてるじゃん。新しいやつ出せます？
はい。
of course. Yes.
眼輪建設除量の目安はありますか？
いや、それは感覚的なもので、ほとんどなくなったなと思ったら、she says the なんか she asked me the amount of the excision amount of the ritual muscle, and it depends on the patient. If a lot, yes, a lot, yes, but I prefer to make it a flat. I dissect and I see the shape of the amount, and I want to get it flat. If I got
ちょっと待ってください。
それは緩むのが分かるってことありますか？
あります。それはなんか正直連続性だけ切ってあげても continuous if you cut the continuity of the orbicularis occlumus, then it will go away. So just the incision is enough, but sometimes too much excision is advisable. 何も問題ないんですよ。今電極だけちょっと見ているだけですよ。フットペダルちゃんとつながっています？いいよ、圧迫で止血できたよ、圧迫。だけどちょっと次の手術は絶対必要だからちょっと、ね、引っ張っていただけますでしょうか。はい。横に。Here
And how far you dissect the subcutaneous?
Maybe
Depends on the patient.
circle 5 millimeter to 10 millimeter. Like this. I dissect. This area, this. So the important thing is here. Yes, upper part, medial part. さあ外して。You can meet. This is the Mongolian. You see?
Yeah.
This is the Mongolian fold, and inside of that was here. Yeah. This is the Mongolian folding of orbicularis occlumus. So, but maybe just cutting is enough, but
Sometimes you need to excise.
yes,
How much do you excise it out?
yes, it depends on the patient too. And I want to get it flattened,
Flat?
flat.
So it depends on each patient.
Yes, but basically I do this like making a mountain and cut. So flattening, flattening. 外してすいません引っ張って inside over here I just make incision to cut the continuosity of the and as you said before, this is the medial canthal tendon. This upper part, medial canthal tendon. You can dissect it over there, and you can tuck that part if you want. Just there. じゃあ目開けて、上見て。OK。I think I cut enough amount, and I want this here to this here. If you go further, then you can come more. すいません、目開けて。もうこれで十分だと思います。OK。待って。ごめんなさいね。すいません。外して。I think this is okay muscle. I want to cut it. 先生参加してもらってありがとうございます。待って。
The last one you cut, the aim is to make it C point move easily, right?
Yes, right. And I think that was forming some contour on the eye. So
I see.
here, eye.
Yeah.
자, 하나 씩て This is a key suture. 이토끼리. 자, 目開けて。目閉じて。 Okay, protein. Right. あ、普通で大丈夫です。So it is almost done. 1 p.m. we have lunch. We will talk about the eyelid for a while. 자, 目開けて閉じて She has a very long, nice eyelash. So beautiful eyelash, but it hinders the operation. So tip.
This is the 60
This is a 60 prolin with round number.
Bless you.
Bless you. 프로인 뭐 있고.
롤링 ください.
こちらに切れちゃったんですよ。
こちらがプロに。ありがとうございます。
半分でいいです。Almost done. ほとんど終わりましたよ。So question.
Any questions?
Can I see this?
Here?
Can I see this?
I'll master.
You can see
Perform
operation
cardiovascular.
on my YouTube channel.
How long do you wait to do it a second time?
Second time?
Mm-hmm.
Second time operation.
Mm-hmm.
If she needs a further revision or some
Yeah,
6 months.
6 months.
And at least 3 months, but prefer 6 months. 開けて、上見て、上見て、上見て、上見て、私の光見て。Looks very nice. Okay. Everything gone. お疲れ様でした。Thank you. Nice. いい外科だと思います。ちょっと見ましょうかね。
痛みはないですか？大丈夫？
What is the youngest age that you'll do?
17 or 16?
Yeah.
Yes. Yes. 早く見たいでしょ。大丈夫ですか？なんか濡れガーゼでちょっとやってみてくださいね。その電極ハンガーに注意。